you, sir. Thank you, everybody. Good morning, friends. थोड़ा light कम कर देंगे. So I have no financial interests. As you can see that if you have a soft cataract, the glow is very good, but it is important to have a good rhexis. The hydro procedure that you do, you have a small point hydro procedure, because if you have a posterior polar cataract, it may be difficult. So you need to have a good hydro procedure and a good separation of the nucleus. As you can see, when you emulsify the nucleus is very, very soft, and you have to use low parameters. You have to be very careful that when you do a stop and chop, here the cataract looked very soft, but it is a grade 1, grade 2, so it could be
light come kar do, please.
So that my video can be seen better if the light is a little less.
Stage ka light bhi kam kar do.
As you can see, this is a stop and chop procedure where easily the pieces were made, the first division, and now the quadrant removal. So this is a comparatively easy soft cataract where a stop and chop technique was able to be performed to do a successful phacoemulsification. And now if you see, this is the second case where this is an extremely soft cataract, and you have to, the whole cataract will be difficult to be stopped and chopped, and it is so soft that what you do is you remove the cataract as a whole and you flip or make a nuclear solute, and then it can be emulsified easily. Very low parameters or only with the aspiration it can be removed. So different techniques are used. This is the epinucleus mode where the epinucleus plate was there to help you. This is a posterior polar cataract where only hydro delineation is done. Hydro dissection is not done because you are scared whether there will be a posterior capsular tear. And you try again to emulsify the nucleus. We think that the soft cataracts are very easy when we start surgery, but as you do more and more surgeries, you realize that they are not only very easy, they can turn out to be extremely difficult at times, and you attempt to do stop and chop here, but you are unable to divide this, and the saucering occurs. Because the cataract is so soft, with every trench there is a gutter into the nucleus, and you may be unable to divide it. But you have to be patient, and then if you can take one piece and rotate it gently. Here you have to be extremely careful because the posterior polar cataract, there may be either a frank dehiscence or there may be a attenuation which by your techniques or wrong fluidics can extend into a tear. This is the epinucleus which remained because we did only hydrodelineation, and in the epinuclear mode, this cataract, the epinucleus is successfully removed. We use the AC maintainer and the Dr. Lahane single port cannula for complete removal of the cortex. Any method by which cortex can be aspirated, may be mechanical or using irrigation aspiration, can be used to do a successful eye. So that's very, very important. So in a cataract, these are the various techniques that you use. Here, this is again a soft cataract where the rhexis is very easy to make, but you have to be careful because if you break the commitment to rhexis, you break the commitment to phacoemulsification. If one is unsure, then even dye-assisted rhexis can be done. In any phacoemulsification, the hydro procedure remains very, very important because it helps to give you a free nucleus and an epinuclear buttress. As you can see over here, this is the nuclear solute, which actually helps you to cartwheel the nucleus and bring it anteriorly. Here, one has to be only careful that you have to use a good viscoelastic to protect the corneal endothelium. As you can see over here, it is going to be impossible to stop and chop this nucleus, but because we have a free nucleus with a good hydro procedure, with a solute and a good followability. So what is important here is a good followability, which means that the ability of the probe to hold the nucleus piece to itself, and if keeping the probe central, you do not have to go and fish anywhere in the periphery. The nucleus comes to you and it can be emulsified. It is very important to be central because otherwise there will be a PC tear. Stop and chop, as you know, it can be done. If the nucleus permits stop and chop, a good rexes, a good glow are the benefits in these type of soft cataracts. And the rexes helps you because it keeps you safe. Now here, as you can see, that the glow was very good, but the cataract is a grade 2 cataract, and it is hard enough to be emulsified by the standard stop and chop technique, as you can see over here. So you make a trench and deepen it to make a first division, as you can see over here, and then go ahead with the standard stop and chop technique. So these are the various techniques of phacoemulsification in a soft cataract. You have to choose the technique as you go. You have to assess the cataract, understanding how soft or hard it is. As you can see over here, this is the first quadrant removal, and now the second. Then rotating the cataract piece towards you to emulsify it, and as you can see that this free nucleus helps you do a good phacoemulsification in that plane without being in the iris plane or above, protecting the corneal endothelium. The chopper assists to bring the nucleus pieces to the probe, and please note that the probe always remains central, which is important in any cataract, but even more so in a soft cataract, because the periphery would be even softer than the center, and inadvertently there would be a PC tear. So there are multiple ways and techniques to manage a soft cataract. As we saw, the solute, the removal of the complete nucleus, stop and chop. And basically what is important is, and what I want to stress here, is not to leave the safe zone for phacoemulsification. The safe zone is the circle within the rexes, and maintaining an anterior chamber, a good phacoemulsification machine with good fluidics which maintain the anterior chamber without any surge is extremely important. Since the cataract is very, very soft, the parameters that we use here would be very low. That means ultrasound would be very low, but your aspiration would play an important role in doing most of the work, and that is very, very important. So one has to remember that this is extremely important. This is another video where you can see that the cataract is extremely soft, and hence forceps are used to do a rexis. You can use anything. This is a younger patient where the capsule would be more elastic, and hence the use of the Utratas forceps. Whatever you use, it is very important that the rexis is complete and is not broken, because that is the first step towards a successful phacoemulsification. One can see very clearly over here that it is a posterior polar cataract, and the capsule is extremely elastic. Hydrodelineation and not hydrodissection is very, very important. Multiple points of hydro procedure, as you can see over here, not concentrating the fluid and aspirating it in such a way that the nucleus is aspirated completely. So one more soft cataract case, as we can see over here. You've already seen some techniques, some more videos that I would like to show if the time permits.
Yes, go ahead.
Okay. So we saw the various techniques and some more videos where you will see the flip, the bowl technique, or the stop and chop. This is a case of a posterior polar cataract once again. Since our course is a case-based technique, we can see multiple videos. As you can see, the golden ring, but multiple small points of hydro, very difficult to chop. So to solute or to carousel this nucleus and bring it anteriorly, and to cartwheel it, as you can see over here, and flip flipping the nucleus, as we call it, and removing it. This epinucleus piece can be easily dealt with later on, either with the irrigation aspiration. Now, actually, you don't try to do a bowl technique. What actually happens in a soft cataract is that when you try to do phacoemulsification, there is a crater effect. The cataract is so soft that every trench results in almost 2/3 of the nucleus being trenched. And this is something which is not very, very desirable, because then you cannot handle it. So the best thing over here would be to flip it or to make it solute. Sometimes if you are not able to do anything over here, and a saucer is formed, you can wait, put visco, separate it again with a little bit of hydro, make it loose, flip it up, as you can see. So this is the most desirable or the most comfortable technique, by flipping the nucleus or making a solute and using more aspiration than phacoemulsification. The epinucleus buttress definitely helps to protect the posterior capsule and also the posterior polar plaque, which can be seen. Again, where you can see multiple hydro procedures with multiplanar hydro dissection can be seen. As you can see over here, this is extremely important to avoid the fluid overload at one place and separation of the nucleus or the nucleus solute. So as you can see, these videos are so beautiful, and luckily we are able to show it, and removing the nucleus as a whole. So we feel that soft cataracts are very, very easy, but they are not, but they can be tackled, and the epinuclear buttress always helps. So here only aspiration is used. You don't need to use any ultrasound. And then removing this epinucleus in the epinuclear mode. So this is also very, very important to use blunt choppers, because you don't want to pierce the PC at any point in time. So what is difficult is there is no grip of the nucleus. It is difficult to chop. There can be an unstable anterior chamber and an unstable posterior capsule. They invite capsular rupture. There may be a frank attenuation, as you can see, and these are signs of caution. You have to be very, very careful, because you have to counsel these patients because they are very, very young, and you have to have a posterior segment ready. So a good Rexis, hydrodissection free phaco, as we saw, low vacuum, low inflow, low aspiration, which are very, very important. So thank you, friends, for all the support and by being here. And if you have any tips to give us or any advice, it's always welcome. Thank you so much.
Thank you, Dr. Ragini.